So here's a mnemonic. When you're actually, you might want to just take a note of this when you're looking at heart murmur causes. You could just spasm is a little mnemonic that you can always use. Just remember that when you're in your NCLEX, when you're sitting for your NCLEX exam, you of course can't bring any material in to the testing center or the room, but you are given paper. You are given paper and you're giving a pen, or you're giving writing utensils, of course. So you are given a paper. So learn the mnemonics, learn what your normal lab values are, learn what therapeutic levels are, and just kind of understand them and remember them. And then from that point, once you get into this testing center, what some people do is they just download everything that they can remember on that paper. So when you download it, you have it there as a resource that you can use and then go from there. So I always like to share different mnemonics when I'm teaching and tutoring and things like that, and in our classes, so that you have that tool that you can then practice with, or that you can learn different things with. So when talking about heart murmurs and causes and understanding them, I like to think of spasm. So spasm is first stenosis of the valve. There's partial obstruction somewhere with that. There may be aneurysm, or maybe related to septal defect or mitral regurgitation. So those are things that you want to think about when you hear heart murmurs, and to better understand what may be causing them, or so on. Remember, we don't need to know exactly what the cause is, but understand that you hear a heart murmur because it is abnormal, because you know what normal is, and that's the goal, is to understanding what normal is, so that then you can use that as your benchmark to understand what abnormal is.